You need a healthcare directive, and I'm about to take away all of your excuses because I'm going to show you how to get a healthcare directive for free on the internet today. Okay, so there's this website. It's called honoringchoices.org. And you can actually go on this website and it's going to teach you about everything that you need to know about doing a healthcare directive. But the cool thing is, in addition to just teaching you about them and telling you about them, you can actually go in the resources tab and you can click to select a healthcare directive that you can put in place right now today. There's a couple of options for healthcare directives that you can choose from. You can see here there's like multiple languages, but I'm going to pick English, and you can either do a short form healthcare directive or a long form healthcare directive, and I'll show you the difference. On the short form healthcare directive, it's really simple. You just type in your name, type in your date of birth, and then you're going to decide here who's able to make decisions for you if you can't make them for yourself. So then you'd go ahead and you'd fill this in. And then you can actually appoint somebody as an alternate healthcare agent if the first person that you choose isn't available. You can also go in here and you can give instructions about your healthcare, anything that you do and don't want. And then all you need to do here in the state of Minnesota is have this notarized by notary public, or you can have, if you don't have access to a notary, you can have it witnessed by two people that are independent. Right. So most people have to be 18 years or older, and neither one of them can be your primary alternate healthcare agent. And at least one of the people can't be your healthcare provider. So you can't have, like, if you're in a hospital, you can't have like a doctor and a nurse, right? So you would need to get like two friends, two other family members that are agents or something like that. And then that would be all that you need right there to nominate somebody who would be able to make healthcare decisions for you if you couldn't make them for yourself. And then this tells you like what to do. This gives you the instructions and things like that for what to do, like after you have designated your agent. Like you should tell them that you designated them and all of those good things. There's also a long form healthcare directive that you can use that is really nice if you have things that, like, say you have known diagnoses, say you know you're going in for surgery or something like that, like then you can do a little bit of a more in-depth healthcare directive, right? So it's the same process, but I'm going to show you the difference here in just a second. You'll put in your address, your telephone number. You're still going to name your primary healthcare agent and your alternate healthcare agent. This one's fancy. It wants you to keep putting your name on every page. And the date that you're completing this document. Okay. Now, this one is going to go into a lot more detail. This is going to say really specifically the powers that you're giving to your healthcare agent. So to do these things, agree to refuse or cancel decisions about your healthcare. It's a big power. Interpret your instructions, review your medical records according to HIPAA, arrange for treatment, decide which healthcare providers you're going to use, and then make decisions about organ and tissue donation and autopsy according to instructions that you'll leave. You can limit the powers here. You can be like, okay, like I don't want this person to be able to do D because I don't want them to arrange care outside of the state or something like that. But if you're picking people that you trust to make decisions for you, it's probably fine for you to not limit their powers. You can also give additional powers to your healthcare agent. So to make decisions about the care of my body after I die, yep, I'm good with that. I'll initial there. If you're married and you trust your spouse, even if you were to get a divorce or something like that, you can allow for them to continue to act as your healthcare agent, even if you get a divorce, or say you have a domestic partner and you guys break up, you can still let them act as your healthcare agent. Maybe I'm fine with that. Maybe that's what I want. Maybe I want the person to make decisions for me, even if I'm unable to speak. And then you can decide here on, like, if you're pregnant or, trying to be, if somebody would be allowed to make that decision for you. I think I'm going to leave that blank for myself, and then you'll go ahead and click through there. Now, you can say lots of other things here, like what treatments you do and don't want, like whether or not you want CPR as a life-saving measure. Then here you can freeform fill various things in, as much or as little as you want, about treatment choices for specific health conditions. So say that I suffer from like severe anemia. Maybe I'm anemic, or maybe I suffer from anxiety or something like that. And I can say I wanted to be continue to be treated with my current anxiety medication and whatever my prescription is and whatever dosage, right? If I'm going to attach additional documents, say I have like a whole care plan from my therapist about my anxiety and I want to be continue to be treated according to that, I could attach that here. I can say things like, I don't want feeding tubes, IV fluids. I don't want to be on a respirator or a ventilator. I can give specific comments and directions about that. And, to what extent, like maybe I want to say, I'm fine being on a ventilator, but if it goes, past 5 days, please take me off, because I believe I might have some sort of like irreparable damage or never be able to breathe on my own again, or my quality of living would be really poor. And so I don't want that anymore. I can decide if I want to donate my organs, if I, don't believe I want an autopsy unless I have to have one because I'm like the victim of a crime or a fatal accident or something. And then you can definitely add more here, or you can even leave it blank. Again, if you're attaching additional stuff, you want to identify that there. And then things that make life worth living the most to me, a high quality of life where I can be surrounded by my family and friends, but I don't want to be locked away in a nursing home where no one comes to visit me. Maybe if I am in a persistent vegetative state, maybe that would be no longer worth living. Maybe I don't ever want, a blood transfusion is one we've seen come up in practice a few times. For a lot of people, I would like to die in my home, surrounded by a family and friends. Maybe I want to be surrounded by people from my church, and I want praise and worship music being played at my bedside. Or I had another lady, but after 3 hours of praise and worship, I want to listen to Elvis. Then you can say here, if you're not religious, you can leave this blank. If you are religious, you can say, where you're a member of a church or something like that. Other wishes and instructions that you can leave. And then again, you just go through and you would execute this. So you would print this document out once you're all done with it. You would sign it in the presence of 2 witnesses or in the presence of a notary public. And then, of course, you're going to do all the instructions in here that keep this in a place where people would know that you have it, because we can't use it if we don't know about it. So you'd tell your primary healthcare agents, you're going to put this on file at your doctor's office, talk to anybody that would be involved if you were like seriously ill or injured, like clergy or, your job or something like that, friends, so that everybody is up to date there. This is a really good practice too, to write down who you've given copies of this to, so that like in the event that you needed this used, the hospital would know who to call if they couldn't, reach your primary, or if you have a different clinic or something like that. So that is how you get a healthcare directive on the internet for free. Now, of course, doing your healthcare directive is just a part of your overall estate plan. So, if you have questions about other parts of your estate plan, make sure you watch some of our other content, our other videos about ways to round out that plan with other documents that you definitely need. You can also check out our ebook, The Parents Planning Pack 10 Steps to Making Sure Your Kids Are Well Taken Care of No Matter What, or just subscribe and follow us for more.
If this content was useful for you, don't forget to subscribe.